bodies. Where would we be without them? That's a question for a more metaphysical show. We're here for science stuff. Like, how does a physiatrist help bodies recover from injury? Fig has the story.
Physicians treat illnesses. Pharmacists provide medication. Frank is a pretty decent plumber. But what's a physiatrist do? To find out, today we're talking to Dr. Monica Rowe.
I was around 12 years old. I was playing basketball. Basketball was my life. And I had knee pain. My mom took me to the doctor because the pain was pretty bad. And the doctor basically told me to stop playing. I was pretty devastated because I felt that if I was a 12-year-old boy, we would have had a totally different conversation and that he would have been more sympathetic. I immediately turned to my mom and said, we have to find a female sports medicine doctor. She looked, but basically told me she couldn't find one. And that's basically the moment where I decided that I wanted to be a female sports medicine doctor.
Monica took that passion for sports medicine to the next level, becoming the team physician for the U.S. women's national soccer team and a physiatrist at the Shirley Ryan AbilityLab in Chicago.
So what exactly is a physiatrist? How did you get into this?
I am a physician. I went to medical school and I specialized in physical medicine and rehabilitation. Physiatrists essentially work on the function of people and they improve function across all different abilities. That will range anywhere from taking care of elite athletes like I do to, taking care of people who've had a neurologic issue like a stroke or a spinal cord injury or a traumatic brain injury. So that's essentially what a physiatrist does. We try to get people back to living their life.
Monica and her team of physical and occupational therapists work out of this cutting-edge facility where they help patients with technology like the anti-gravity treadmill. This technology was first developed by NASA for astronauts to use in space. A tightly sealed bubble surrounds the patient's lower body, allowing a cushion of air to support their weight as they walk, jog, or run.
When I'm typically running, on a regular day outside, I feel a lot of weight bringing me down, but this is really holding me up. And it almost feels like if I was to be running on Mars or the moon.
But before you learn to run, you need to learn how to walk. And many patients build strength and confidence using the lab's body weight supporting harnesses.
Walking is an essential function that a lot of people really want to get back to, particularly after a devastating injury. So this helps people get back a sense of normalcy when they're trying to learn how to walk again. When you build someone's confidence going up and down these stairs, then after some time, once their confidence is built, you can get them going up a long flight of stairs like that. What's also really nice about this is if they lose their confidence halfway through, we can actually pull them off the stairs, float them up, and then float them down gently back to this base landing. So are you ready to try it out?
Physiatry is a team-based approach to care, so Monica has one of her expert physical therapists, Holly, come help.
Do you feel like it's supporting you?
I think I can let my weight go here and just kind of hang.
Yeah.
With her joystick, Holly can adjust how fast we move and how much support the harness gives.
Basically, the harness will catch you.
Right.
So you can't fall.
So if I tripped, I would just fall into the harness.
Exactly.
Like this. To see yourself walking up the stairs in front of this mirror, it's like taking seeing is believing to the next level.
We think the mirror is super helpful in a patient's recovery because they can envision themselves walking up those stairs and they can see themselves actually doing it. So it's really helpful for their motivation.
Okay, I have one last question. Can I fly down these stairs?
All right, Holly, you want to make her fly?
Got it.
Look, Mom, I'm flying. It's a bird, it's a plane, it's big.
Okay, this is built for therapy, not thrills. It's more floating than flying.
If you're watching this, you must have really liked the video. Make sure you follow and subscribe and check out these other videos that are even better. No, really. I've seen this one over 100 times.